Why do drive TB patients on Delamanid sometimes relapse? Imagine fighting a tough battle against tuberculosis that refuses to go away easily. When tuberculosis becomes resistant to the usual medicines, it's called drug-resistant tuberculosis. Specifically, multi-drug-resistant tuberculosis is resistant to the main drugs used to treat it. Delamanid is a newer medication that helps in these difficult cases, but even with its use, some patients still experience a return of the disease after finishing treatment. So why does this happen? One major reason is that the treatment might not be fully completed or the patient might not follow the prescribed regimen closely. If the full course of medication isn't taken as directed, some bacteria can survive. These surviving bacteria can become stronger or resistant, causing the disease to come back. This is why sticking to the treatment plan is so important. Another factor is the development of resistance to the drugs themselves. Even though Delamanid is effective, bacteria can sometimes develop resistance if the medication isn't used properly. This can happen if the drug doses are too low or if treatment is stopped too early. When bacteria become resistant to Delamanid, it becomes harder to eliminate the infection completely. Having a co-infection with HIV can also increase the risk of relapse. HIV weakens the immune system, making it harder for the body to fully fight off tuberculosis bacteria, even after treatment. This means that some bacteria might still be lurking, ready to cause a recurrence. Environmental and social factors play a role too. Living in crowded places or areas with high tuberculosis rates increases the chance of getting reinfected. Sometimes what looks like a relapse is actually a new infection, especially if the bacteria are still circulating in the community. Healthcare system challenges are also important. If health services don't provide proper follow-up, support, or monitoring after treatment, patients might not complete their therapy or catch early signs of relapse. This can lead to the disease returning or worsening. To reduce relapse rates, researchers are working on better treatment combinations that include drugs like Delamanid and bedaquiline. Supporting patients with counseling, social help, and regular checkups is essential. Continuous monitoring after treatment helps catch any signs of recurrence early so that prompt action can be taken. In summary, relapse in drug-resistant tuberculosis patients on Delamanid can happen for many reasons, including incomplete treatment, drug resistance, immune system issues, environmental exposure, and healthcare gaps. Addressing these factors requires a comprehensive approach that combines improved medications, patient support, and strong healthcare systems. Always remember, if you or someone you know is undergoing treatment for tuberculosis, consulting healthcare professionals is the best way to ensure the most effective and safe care.